Karaokes, bars and nightclubs in Hong Kong will be forced to close again in 2 days. The decision comes as the territory reports another 80 new cases of COVID-19. It's the city's highest daily tally in 3 months. This will be the third time these businesses have been forced to shut. Hong Kong Chief Executive Carrie Lam says that testing plays a crucial role in a fight against the virus. And until a vaccine is available, she won't hesitate to invoke powers to force residents to get tested. Roland Lim with more.
The closures of more premises comes at a time when the government is ordering the mandatory testing for people who've been to 21 dance halls since the beginning of this month. Now, it's believed that a super spreader cluster originating from these dance clubs have led to more than 130 confirmed cases so far. Just last week, that number stood at just 4 infections. Health authorities are also enlisting the help of the police to trace up to 1,000 people related to this particular cluster. Mandatory testing will also soon be required for other high-risk groups. That is, all staff in elderly and disabled home care centres, taxi drivers, and those who have respiratory symptoms when visiting the doctor. The government is also going to be forcing restaurants and other premises to sign up for its coronavirus contact tracing app called Leave Home Safe. However, it won't be mandatory at the moment for customers to take part in the tracking system.
If one look at those international statistical compilations, you will realize that Hong Kong is not doing that at all. So let's have confidence in ourselves that by putting in our best efforts, by government taking the lead, and by individual citizens playing their part, this is still the time for avoiding close contact. This is still the time for not going into high-risk places.
Mrs. Lam also announced that the testing kits will be distributed at some 121 post offices across the territory, and there are also plans to hand specimen bottles out at subway MTR stations. People can also take tests in 5 ways, that is, picking up specimen collection packs at designated clinics, at approved private laboratories. There are 4 government testing centres and mobile collection centres, or at public hospitals.